Hello, everyone, and thank you all for tuning in to the Mayor's Pre-Summit Conversation Series. On September 15th and 16th, DC Mayor Bowser will host the 4th National Maternal and Infant Health Summit, and we are excited to highlight the importance of maternal and child mental health. For more information about the summit, please visit dcmaternalhealth.com. Again, that's dcmaternalhealth.com. So my name is Adrienne Griffin, and I'm the Executive Director of Maternal Mental Health Leadership Alliance. Today, I'm going to be leading a conversation about maternal and infant mental health. This presentation uses both the terms maternal and perinatal mental health to describe mental health in the pregnancy and postpartum periods. This reflects both a long history of advocating for maternal mental health in the policy space and the ongoing discussions within the field about including all childbearing individuals, not just those who identify as women or as mothers. With me today are two fabulous women from Mary Center, Austin Holloman and Georgette Saad. So Austin and Georgette, would you please both introduce yourselves and tell us what brings you to this important work?
Hi, thanks, Adrienne. So glad to be here. My name is Austin Holloman. I work in the maternal mental health program at Mary Center. I am the program coordinator. I'm a mental health therapist. I also manage our brand new doula referral program at Mary Center, which is something I'm super excited about. And I absolutely love this work. I think the more intervening and supporting we can do with our pregnant folks, and it's really going to affect the whole life course for our babies that are born and then grow up. And so it is just an honor to be able to do this work and to be here with you all today. Thanks for having me.
Oh, we're so happy to have you with us. And Georgette?
Thank you. So I manage the early childhood program at Mary Center, really since its infancy, so to speak. And as we've kind of evolved and grown over the years, we've spanned from interventions that go from 2 years old to 7 years old, and we continue to move down to the beginning of life. So we're really excited in the last year to really have endeavored in the infant space and more specialized treatment with a lot more collaboration with the maternal mental health program. Happy to be here.
Awesome. So thrilled to have both of you here. So we're going to be diving into some of the programs at Mary Center, and then we're going to be circling back up to take a look at policy. That's the field that I work in. So we're going to try to tie it all together with a big bow at the end. So let's go ahead and let's get started. So initially, we're going to talk about maternal mental health. So Austin, let's hear from you about this important topic and what Mary Center is doing.
Yeah, thanks, Adrienne. So maternal perinatal mental health is incredibly important for a number of reasons, but one of which that is growing knowledge, but still a lot of folks may not know, is that perinatal mood and anxiety disorders are the most common complication of pregnancy and childbirth. And that includes sort of more classic medical complications. And yeah, as a mental health complication, it's the most common experience that our folks are having while they're pregnant or after having their baby. It affects at least 1 in 5 individuals during their pregnancy or postpartum period. And as we know, those numbers are even greater for certain populations. So 1 in 3 or so low-income folks and folks from the immigrant community, which we work very closely with at Mary Center, are experiencing mood and anxiety disorders during their pregnancy or postpartum. And that's at least 800,000 families a year in the US. And we know that this is probably underreported and underscreened for, right? So these numbers are even higher than that. And when we're talking about perinatal mood and anxiety disorders, it's important to know that we are, yes, talking about anxiety and depression, but also things like OCD, PTSD, and substance use disorders as well. I think one statistic that's particularly alarming is that suicide and overdose combined are the leading cause of death in the first year following pregnancy. So this is a really serious and really important issue to be thinking about and talking about, because we are losing new parents to this every day. It has a really negative long-term impact, not only on the parents themselves, obviously, but baby, which Georgette will spend a lot of time talking about today, entire family systems, and then, you know, our country, our society as a whole, numbers wise, because we know money talks, right? we're spending a ton of money on these issues every year, at least 14.2 billion. And that's addressing both the poor health outcomes of parents and their infants related to these perinatal mood and anxiety disorders, but also thinking about things like lost wages and productivity for parents who, even if they did want to go back to work, for example, their mental health is preventative of that. So this slide specifically talks about depression and anxiety because they are the more commonly experienced perinatal mood and anxiety disorders, while, as I said in the slide before, there's a whole other host of diagnoses that fall into this category. So for perinatal depression, we're looking at feeling hopeless, worthless, lots of lack of motivation, low energy, loss of concentration, loss of interest or pleasure in activities that brought pleasure and joy prior to experiencing this depression. And then feelings of anger, guilt, irritability, regret, lots of, was I even meant to be a parent? Can I do this? Lots of self-doubt. For anxiety, we're looking at feeling really overwhelmed, just like crushed by the stress. Like, I don't know if I can do this. Very worried, which of course new parents are all going to be worried, but this is to sort of a whole different extent, right? We're worried, so we're not sleeping, we're hyper vigilant, like we have to be around baby or looking at baby, making sure baby is safe at all hours of the day and night, which reduces sleep even more sometimes than parents already get, which is very little, as you new parents know out there. This could look like scary, intrusive, or racing thoughts, often about harm coming to the baby. And then, feeling on edge, restless, panic attacks, all of those things fall under anxiety symptoms in this period. And this presents with a lot of different sort of thoughts or phrases, but some pretty common ones are, having a baby was a mistake, or maybe I'm not meant to be a parent. I'm not bonding with my baby. Maybe my baby deserves better than me, right? I'm afraid to be alone with my baby. Lots of like, I can't even trust myself right now to do this thing that I maybe really wanted for so long. Exhaustion, not being able to sleep when baby sleeps, and just, I'm a bad mom. My baby deserves better. We hear that all the time, which is just heartbreaking. It's just such a tough thing to hear from our new parents.
Yeah, and this is one that, we really pay attention to when new mom says, my baby would be better off without me, or my family would be better off without me. We really want to pay attention then, because that's really the cry for help.
Right. And that could be a flag for something like the beginnings of suicidal ideation, right? Like if you're really feeling like your baby deserves better, that could really escalate to like, my family is better off without me. Like I don't really need to be here. And that very much is a red flag. So thank you for pointing that out. So when we think about how do we intervene, right? How do we support families? What do we do when folks are experiencing some of these symptoms while they're pregnant or after they have a baby? We talk about this sort of spectrum of interventions, starting with prevention all the way up to treatment. And then you can think about like ease of access and affordability. And so really the goal is to support during pregnancy, right? And that's why we stress screening for these things, not just after baby is here, but from the beginning of pregnancy, we're looking for these signs and symptoms, because the earlier we can catch them and the earlier we can intervene, we can do a lot of really good preventative work and boosting those coping skills so that when baby does come, it really ups the chances of a positive postpartum experience, then supporting infant mental health and attachment, which Georgette will get to in a little bit. So we can look at all sorts of changes at home, right? And doing a ton of education for parents before baby even gets here on, how we can support the best sleep patterns. How is our nutrition playing a role in how we're feeling? How do we ask for help? Oh, this is such a big one. And I coach parents on this all the time. And it's so hard for new parents. Like, how do I ask for help? What language do I use for that? How can I manage the feelings that come up? Because I don't like asking for help, right? I'm told that I can do this on my own. It's a failure to ask for help. Really addressing those things before baby even gets here can be super helpful. Time alone, what a precious commodity, right? After you have a new baby, but even just 15 minutes, right, of time to be by yourself can be so supportive for mental health for new parents. Exercise, we know, is very, very supportive for mental health. So those are all things that can be done via education, via support in pregnancy, and hopefully setting the stage for knowing what some of these positive behaviors could look like after baby comes. Once, baby's here and we feel like we could use some more support or some more direct intervention, there's a whole host of options, ranging from, home visiting, parenting education, going that sort of route. I found, especially during COVID, that support groups and bringing parents together is so incredibly therapeutic, because the isolation is even more strong and prevalent right now during COVID, right? With people not being able to be physically present with each other. And so just being in a group of other parents, feeling like you're not alone in your struggles, so supportive for our mental health. And then, if this is persistent, if the symptoms are a bit more severe, or if a parent is just really interested in getting support and help, therapy, whether it's individual, group therapy, and obviously psychiatric medication referral and support can be super supportive during this period. So we really have a whole spectrum. And I think the main point of this is that treatment doesn't have to look like one particular thing. And, there's a whole umbrella of these things for a reason. And sometimes it takes sort of a puzzle piece putting together of these things to create the best support and treatment for a parent.
One of the things that I really like about this is that as a new mother, you don't have to jump right to medication, right? Because there's concern, right? What's the impact on the baby if I'm pregnant or if I'm breastfeeding? Like, there are lots of options, and that all women recover with some combination of these different options.
Yes. And that is the main point that we drive home with all parents, is like, this feels really, really hard, really scary right now. And I can guarantee you at some point, like, you will feel better and this will feel easier. And that's a really hopeful message to hear.
Yep.
Yeah.
Yep.
So important. So why is this important, right? I mean, obviously we want to take really good care of our new families, but I think it's important to think about what can happen if our parents aren't getting screened and treated for perinatal mood and anxiety disorders, because it really can have pretty severe impact on not only the mother or pregnant new parent, but also the infant. And so when we're looking at impacts on the mother or the parent, poor management of their own health, looking at, I'm gonna feed my baby maybe, but that'll take all the energy I have because I'm really depressed and I'm really exhausted. So then I'm not gonna feed myself, I'm not gonna prioritize my own needs. And that could be really dangerous, right, for our bodies after having a baby or when we're pregnant. Substance use really can be really prevalent in this population if these things go untreated, because you're desperate to feel better and you kind of want to escape, right? And that's one way of doing it. And we know that could be really dangerous to a fetus if you're pregnant or after you have a baby. That's not good for us. Experiencing abuse, you're more likely to experience abuse in your relationships if you do have untreated mental health issues. And that's something we see, unfortunately, a lot with our clients. They're also navigating domestic violence, trauma histories, things that sort of exacerbate some of these issues. As Georgette will talk more about, it's really hard to be responsive to your baby's cues when your mental health is not good as a new parent, and that can be really harmful for your attachment and your bond to your baby. Having fewer opportunities to, as Georgette calls it, delight in your baby, like really appreciate those positive interactions. It's really hard to do when you're, for example, really depressed. Breastfeeding challenges, breastfeeding can already be very, very challenging for new parents and look really different for different folks. But if we're not feeling well with our mental health, like, where's the motivation to push through that, right? Or maybe I don't even have the energy to call the lactation consultant to get the help that I need. So it can just make pretty normal challenges in new parenthood and sort of these learning curves that we have feel insurmountable, even more so than if you weren't experiencing mental health challenges. And then, as I said before, there's just this question of can I do this? Am I even meant to be a mom? And that's, or a parent, and that could be so harmful to, the parenting experience and with the baby too. for infant and child implications of untreated PMADs, again, Georgette will elaborate on this more, but high stress, anxiety, poor mental health in pregnancy increases our chance of preterm birth. So that can lead to low birth weight, small head circumference, which can lead to other developmental issues for babies, longer stays in the NICU, which further exacerbates mental health challenges for parents, right? You can have an increase in sort of excessive crying or hard to soothe babies after they're born. Again, an impaired interaction between parent and child, and then really sort of long-standing behavioral, cognitive, or emotional challenges for that baby that we can track even into their older childhood and adolescence. And then, looking from a family unit, if you have these families that are experiencing increased anxiety, or really depressed, they're more likely to go to the ER or to the doctor, right? Because they're so worried about baby, and it's really expensive, it's time consuming, it's stressful on the family. And if baby doesn't need to go to the ER, like what is that doing to that family, right? To keep going to the ER, to the doctor, worrying about baby's health. It can make it seem really challenging to manage if there's any health conditions with the child. Again, like any normal challenging experiencing in new parenthood can just feel that much more challenging. And then it can make it hard to follow guidance and adhere to medical advice for yourself and for your baby. So the list is probably even longer than this, but as you can see, there's just a lot of could be really harmful impacts of untreated PMADs.
One of our colleagues at Children's National noticed that new parents were coming into the pediatric ER over and over again, hypervigilant about their baby, coming in again and again, being worried. And she said, you know what? The baby's fine. I'm worried about the parents. And so they started screening the parents at the pediatric ER at Children's National for anxiety, and were able to pick up postpartum depression and anxiety there. So just to drive home the point that there's many opportunities to intervene and talk to parents about these issues.
Absolutely. And that's why it's so important that any professional or just family member that has pregnant or new parents in their lives be really educated on these issues and what to look for, because it really does take a village, and any one of these providers or family members could be the person that notices these and helps get this parent into care. So it's just so important that everyone is educated about this.
Yep. So this is a great opportunity. We're going to segue now to talk about infant mental health. And this is Georgette's field of expertise. So she's going to take it from here.
You're still muted, Georgette.
Okay, there we go. Thank you so much for that segue. I'd like to go back just one. When we think about infant mental health, we're really thinking about this extension of the parent in this situation. And so I'm going to go just back one slide just to think about that overarching conceptualization and really distill what Austin was sharing with us and what Adrian's been walking us through as we think about this realm and this population that's really in need. And I'd like to go back really to those negative expectations. So Austin was sharing how mothers and new caregivers who are new parents have these negative expectations. My baby doesn't love me. I can't take care of my baby. My baby's better off without me. Those are what we see here circling around these negative expectations. And so when a parent, this conceptual model offers that when a parent has these negative expectations, it creates a bit of a barrier to read signals. And so that parent might be starting to misread signals of their baby about when they need things or when they need some space and really need to be encouraged and have confidence in. That will often lead to what we see as a non-supportive response that will then elicit and create this foundation of negative expectations that the child will have in their parent. And this reliability that we would really like to see between the dyad of when I need something, you're going to take care of me. And for the parent to say, when you need something, I can take care of you. I can be there. I can support you, building this parental self-efficacy. And so when these negative expectations begin to kind of be programmed into the child at such an early age, then they also develop negative interpretations and they build defensive strategies such as turning away from the parent. really needing that parent to nurture them, to take care of them. But then because these defensive strategies look like turning away or being really difficult to soothe, which then leads to additional distorted signaling of those attachment needs. And so to sum this up, it's really what begins to develop are these cycles of misattuned communication. And so our task and our role in this is to really help bridge the parent's mental health symptomology and really help thinking about and parsing and untangling some of that symptomology. It's really getting in the way of that attachment relationship, turning the dial around to really develop a more attuned communication pattern between that dyad as the parent builds that self-efficacy and the child begins to learn and realize and rely on their parents' confidence to really take care of them, delight in them, nurture them, and follow their lead so they can explore the world.
So basically, you're talking about going from a negative feedback loop to a positive feedback loop, right?
Exactly.
Yeah.
Exactly. So one of the ways that we do that is through this intervention called attachment biobehavioral catch-up. So this is a model that's really quite amazing. It's a short-term family-focused model. So we're moving away from this individual lens to really more of a family approach, with this understanding that the crux of a lot of symptomology does go back to relationships of some sort, whether they're past, present, or newly forming, in this case, with baby. The attachment biobehavioral catch-up has three separate kind of offshoots of the model, one being modified ABC, which mothers can start with beginning in the third trimester, and then moving into ABC infant, which is what I'll talk about today, and then ABC toddler. So really thinking about this early development from in utero through toddler, the toddler age, which for the purposes of ABC, we talk about toddlerhood being up to 48 months, and thinking about how the dyad can really move from a disorganized attachment to a much more organized attachment, for really thinking about that positive feedback loop and really embedding that in the dyad to create attuned communication. And so ABC, we're offering 10 weekly 1-hour sessions that are bookended by a pre and post assessment to really think about and look at that interaction in a really supportive, nurturing, compassionate way, and highlighting all of the amazing things that that parent is doing for baby already. And all we're doing is we're turning the dial just enough so that the parent, one, is noticing all of the amazing things that they're doing, and then also just increasing the frequency just a little bit oftentimes. We're not really looking at giant leaps and bounds of change that's going to completely change the character and the inherent nature of parents, but more so really pulling out the strengths and giving the parent more access to those existing strengths, to those intuitions that are somewhere in there that are often masked and fogged over by those symptoms that they're experiencing. This service is all home-based. So we either have providers go to the home, but of course, in the nature of the world that we're in today, all of the services are remote. And so we anticipate for sustainability reasons, we'll continue to provide remote services so that parent and baby can stay in their home, have access to their space and their toys and their books without having to worry about any kind of concerns about any germs or transmissions of any kind. We know that babies love to put everything in their mouth. So we'll continue in that lens. It is an opportunity to receive a lot of video feedback. So not only do we use videos throughout the sessions of other families who have consented to show videos of an interaction to illustrate things like when a baby is difficult to soothe or when they're asking for nurturance, what it looks like to follow the lead. But also we go back and we pull clips from the previous sessions and say, Mom, look at this amazing moment where baby really needed you and you didn't miss a beat. You were right there. And that's how baby is going to know that you will always be there whenever they need you. So to really, again, reinforce and highlight all of the amazing things that mom is often already doing or parent is often already doing, but it's really hard to notice those moments when they're already overwhelmed by so many other circumstances that they're often going through. And we're all going through, really, quite frankly.
Yep. I know, Georgette, when we were talking about this at the beginning, I was telling you how I used to run support groups for moms with postpartum depression. And right, the mom would have her baby and she'd be rocking her baby and she'd be saying, oh, I'm such a terrible mom. I don't know what to do with my baby. And I'm like, yes, you do. You're doing it. Look, right? So we do these things. And I love that this program points these out and supports them and has that positive reinforcement.
Exactly. And to that point, that's exactly what a parent coach does. A parent coach in that moment might say something like, oh, baby is a little fussy and you're holding and you're rocking baby and rubbing their back. And oh, and I hear baby calming down, beautiful nurturance. That's how they're going to know you're always going to be there for them. So really illustrating the really micro decisions that parent is making, baby's response, what that's named, and the long-term implications of that moment, because it really is moment by moment in these interactions. And it's, again, so easy to kind of put this glossy brush over and say, the baby never stops crying. Well, but you really do this, and baby's not crying right now. But again, easy to get kind of swallowed whole by those moments. We do discuss things like nurturance, following the lead with delight, and avoiding overwhelming and frightening behaviors in this model. And we really do it in a way that's very carefully leading up to more difficult themes. So we do start from a very strengths-based approach with this. So in this, these are the targets right here that we offer this way of targeting ways to enhance parenting. So we take whatever a parent's baseline is, we're just, again, bringing it up a couple of notches, really highlighting the value and the moments opportunities for nurturance, the importance of following a child's lead, even really early on in infancy when all they can really do is hold your finger. Those are the moments we want to look at. Oh, they're reaching out and you put your finger right there so they can reach out and hold on to you. That's following the lead. And it can be just that tiny. And so as baby gets older, depending on where we are in treatment, we talk about what it looks like at 6 months, what it looks like at 8 months, and so on, up to 24 months in the infant model. And towards the last sessions, what we'll do is we'll say, I wonder what you think following the lead would look like when your child's 8. And what about 15? And what about 17? These look really different, and they're extremely important values to continue to hold in your parenting relationship, including this last target, really avoiding frightening behaviors. So we're doing frightening intrusive behaviors. And as we can see here on the right of the graphic, what we're doing is we're improving the attachment quality, and we're supporting early self-regulation capacities for baby, and improving and building upon parents' self-regulation capacities. And we do that. The big change factor here where we support these targets are through these what we call in the moment comments. So here we have, ABC has abundance of evidence, and for the purposes of time, I'll just focus on this one. What we see in terms of pre and post is we see an increase in parent sensitivity. So when we think about that attunement and misreading cues, we see an increase from baseline to post-assessment of sensitivity, a decrease here in intrusiveness, and an increase in delight. And this last one here on delight, I will say, is probably one of the domains that we certainly do a lot of commenting on, but it's often much more natural. That's the smiling at baby, laughing with baby, kissing baby. All of that is delight, saying, wow, clapping your hands whenever they do the most amazing thing, which really is sometimes lifting their head. That's delight. And that really translates directly to building a child's self-esteem and showing them the importance, right? That whole concept of you are the apple of my eye, right? In the theoretic world, we talk about how that statement is really because you're holding baby so close, they can really quite see their reflection in your eye, and you can see yourself in their eye. And that positive regard is what we're building through this concept of delight.
That is just so amazing. And I feel like it's just bringing tears to my eyes. I remember having that delight with my children, except for I have 3 children, and one I did have postpartum depression with. And it was much more challenging to feel some of those things. So I'm so glad that you're doing this work. It's just so important. And it's almost like every parent should be able to have access to these programs, especially as now my children are 17 and whatnot, and I could use some of that positive reinforcement, right? So we're going to switch gears now, and Austin's going to talk a little bit about the Mary Center programs to support moms and babies.
Thanks, Adrienne. Yeah, so Mary Center is really founded on this idea that it's not just about healthcare, right? When we're talking about health and well-being, that if we don't have the other domains of our life really supported and whole, that we can't be well. And so our social change model really looks at, well, what are these other domains and how can we support them? And so all of our programming at Mary Center is intentionally made to be very integrated and focused on this model. So how can we support not only health and mental health care, but also, social needs, right? Like if you don't have a house, if you don't have a source of income that is steady, if you don't have social support, right? All these things are incredibly important and necessary to health, mental health, same with education and opportunity, right? If you don't have the ability to engage in these things that are going to help you move your life forward, and the self-esteem, this idea that like I can actually do these things and I'm supported in them, we're not going to get to where we want to go as a family unit. And so this is one of the really beautiful things that I think Mary Center does really well, is having the opportunity to offer services in all of these domains to our participants under one roof, which is so important. And so specifically looking at these populations, we have, as you can see on the slide, a ton of different programs and resources to support our families as a whole. So looking at our perinatal mental health and our infant mental health, everything in between. And so for our maternal mental health program, looking at perinatal mental health, we offer a variety of different therapies. So this could be individual short-term therapy through our integrated behavioral health therapists, which work exclusively in our medical clinics. And the idea is that, especially in parenthood, sometimes our parents aren't going to be looking out for their own health or mental health or feel the capacity to do that, but maybe they'll be showing up to the pediatrician appointment with baby, right? And if there are therapists there that can get a warm handoff from that pediatrician saying, this parent screened positive on a depression screener, or this parent is just in tears in my office, that's such a good point for them to just be there and show up, right? And to be able to have that point of connection when a parent really needs it. We have an online pregnancy and postpartum support group in English and in Spanish that have been so instrumental, as I said earlier, in supporting parents, especially during COVID, right? And breaking down those feelings of isolation using technology and the ways we've been able to expand our telebehavioral health services. We have psychiatry. As we know, sometimes medication is really important and necessary in the treatment of folks who are experiencing PMADs. One program that I am really passionate about that I am newly managing is our doula referral program. So we are partnering with Graceful Fusion doula training with Nick Heidbreder, and she is working with her incredible team of volunteer doulas to provide birth doula services for free to our participants. So anyone who's pregnant and receiving prenatal care at Mary Center can get a doula for their birth. And we know that, you know, birth trauma, complications in birth, these things directly impact perinatal mental health in really harmful ways. And so birth doulas are incredibly supportive to mental health in the postpartum period for our parents and our babies. So it's a really exciting new program that we have going on. We also have a whole team of folks that are dedicated to coordinating all these services, right? Because you're a new parent, you're exhausted, you have 1,000 appointments. It's hard to remember one more thing sometimes. And so having someone who can really hold your hand, call you, walk you through and remind you when you have your appointments, and really sort of piece together this care for you and with you is, I think, one of the more important pieces of our program that ensures success. Referring to Georgette, for example, these are all things that our care coordination is able to do for new parents. And we also do a ton of training for our medical and program staff. As we said, all of our providers that are interacting with our pregnant and postpartum participants need to be able to notice those signs, right? And be the person, if needed, to support that person in getting the help they need. So that's really important that all of our providers are trained in perinatal mental health and what to look out for. And then, you know, we spend a lot of time and energy working on building this beautiful community that we have in DC in the DMV area around perinatal mental health and health providers. And so we do that in a number of ways. Our most recent initiative that we started that's really excited is the Perinatal Mental Health Echo. And Georgette actually just presented ours today about early childhood mental health. So it's a really great way for folks to come together once a month in the community and talk about just our different perspectives as people working in different fields on perinatal mental health and how we can strengthen our relationships with each other as providers, how to better care for our participants in this area. So it's really exciting stuff happening. And then we have an annual symposium. This is our 3rd year that Mary Center runs, really focusing on perinatal mental health and looking at similar themes as our ECHO. So we have that coming up in November. And yeah, we're really excited to keep building community with folks. Georgette, do you want to talk a little bit about our infant mental health resources at Mary Center?
Yes, thank you. And just to plug, the Echo and the Symposium are both just chock full of wisdom and just amazing collaboration of providers, which is really amazing to witness and be a part of. For infants mental health, we really specialize in short-term family therapy with an understanding that parents are overwhelmed really no matter what age their children are, and really would like to get down to the heart of what's going on. And so we do talk about it as short-term family therapy. And that being said, that if a family continues to need support, we certainly continue to provide that support. And so on that lens, we also do offer caregiver groups, which have really grown robustly in the last year, including a circle of security group, as well as a emotion-focused family therapy group. And so again, we continue to offer them support, as well as booster sessions and check-ins once they're done with the specific model of services that we provide. We do also refer for psychiatry services and offer care coordination. So oftentimes, Austin or the maternal mental health program will refer to me into the infant mental health program, and then vice versa. We'll be working with caregivers who really could use additional support, and we'll refer to them or refer to one of the other several programs in Mary Center or outside of Mary Center. And then lastly, we also offer trainings and workshops for staff, both internal to Mary Center as well as to community partners in the different partnerships that we've developed with schools and daycares and different community centers that are doing some really great work with families, and we support and they support us. And additionally, we have other programs that support family wellness, and we also collaborate with, including home visiting, centering, with WIC and health insurance, offering caregiver connection to that, as well as advocacy around DV.
You know what, I just have to tell you, it's just so amazing how Mary Center has taken these programs and really, knitted them all together to really help parents get off to the best start possible. I can remember feeling when I had postpartum depression, I was like, okay, now I have to navigate the whole mental health system, which I know nothing about. And it's not even a system, it's just like a crazy mixed up world. The fact that you hold the parent's hand and walk them through this and connect them with resources and with programs, and it's all at the same location so that parents aren't running all over the city trying to get care from different places, is just so fabulous. So hats off to you and the Mary Center for really taking this so seriously. And this is the kind of care that should be in place at any community health center. So great modeling, great modeling. Thanks so much for sharing all of this.
Yes, thank you. It's something that we continue to strive towards for sure. And I think now we're going to move towards the case presentation that Austin's going to share about.
I know, I'm very excited to hear about this.
So we thought that in order to make some of these concepts live a little bit, if you will, and really highlight how sort of integrated services looking at both perinatal and infant mental health can be really supportive for our participants. So this is a case that Georgette and I are currently sharing. So this is very much sort of real life here. This is someone who I saw for an intake for individual therapy, who was referred by their provider, their OB. And then after talking to them, I thought, Georgette might be a really good person to consult on this case. So we're sort of now working hand in hand. So this participant is a Black female identifying cisgendered woman. She's 25, English speaking, and has an 8-month-old baby, first baby. She was referred again by her OB. She screened positive on her Edinburgh postnatal depression screener in one of her postpartum visits. And so they flagged her for us and sent her a referral. Upon meeting with her, she was diagnosed with depression, perinatal onset, so started in pregnancy, pretty early pregnancy for her. She also has a pretty extensive trauma history, PTSD diagnosis, and has some psychotic features that we're still exploring together in session. She's not currently medicated for any mental health or physical health condition. Again, this is her first pregnancy, first birth. The pregnancy was unplanned and very much undesired by mom. She attempted to terminate the pregnancy twice, but ultimately was coerced into keeping this pregnancy for religious reasons by her mother, her adopted mother, who she identifies as her primary caregiver growing up. And so that is a key to this case that we will get to. Again, she's experienced a pretty extensive trauma history, physical and sexual abuse, both as a child and adult, had CFSA involvement in her childhood and was ultimately adopted by a family that she identifies as her family. She was homeless for a while she was pregnant. She lived in a shelter, which is just an incredibly stressful experience, both on her and on the baby as a fetus, right? We know that stress really impacts a lot of development during pregnancy. And she was being abused by the father of the baby during the pregnancy, which is why she ended up in a DV shelter. Very much has sort of a lack of social support, feels really isolated, and has a number of social service related challenges. So is in a housing program now, which is great. Her housing situation is a bit more stable, but she's interested in going back to work, but is having a hard time finding affordable childcare, which, as we know, is a huge issue for a lot of our parents, and the reason why something like policy is so important to this bigger picture. So she stated her reasons for therapy are she's just feeling really, really awful right now. She's really incredibly depressed in her postpartum period. She feels really overwhelmed. She feels completely incapable of parenting and frankly kind of uninterested in parenting, and doesn't know if she wants to continue to parent this child, and is just really kind of stuck in this cycle of not knowing and not wanting to be judged for her decision, and not feeling supported by her mother, who's one of the only people in her life that is close by and helps them with the baby. And so she just has a lot of really hard decisions to make, and it's all really clouded by some pretty severe depression symptoms, which makes it even harder to sort of think through all of these complicated things that are going on for her. So when I was thinking about this case, and some of the reasons why I decided to call Georgette and to consult with her, is that in a case like this, like, we're talking about mom's mental health, but obviously it has such a direct impact on baby, right? And so some of the considerations that make it a perfect case for collaborating are, what are the impact of these depression symptoms and her social service needs, like, on her ability to parent, meet baby's needs, and her desire to parent. What is the impact of that maternal depression on her attachment to her baby, and what is that doing to baby's development, right? And long term, how might that impact baby's well-being? And then, how can we support all parties involved here, right? Not just mom, really taking, baby's well-being into consideration, but also sitting with this really tough decision of, I don't even know if I want to parent, right? So how can we make sure that this baby's needs are getting met while this mom is currently parenting, given that she never really wanted to parent and might decide to give this baby up, right? Or to pursue other options. So it's just a really interesting case to look at from the mom and the baby perspective, which is why we're collaborating. So we thought it might be helpful to sort of walk through from our individual perspectives as, the perinatal mental health therapist and the infant mental health therapist, like, what are we thinking about in terms of treatment considerations here? And so as mom's individual therapist, I think my primary goal is to really address those perinatal depression symptoms and causes, right? Because again, if we are really, really depressed, everything else is going to feel nearly impossible. And it's really hard to start from that place and feel like we're making any other sort of growth in client goals if we're not addressing those symptoms. And so for this mom, that's going to look like probably a psychiatry referral, because she's open to that. Sometimes if it's a really severe case, medication would be really helpful. So we're going to start there with her, try and address that depression, and then really just provide the safe space that she hasn't had to think about and make this decision about, whether she wants to continue parenting, and to explore what are your options, even because she's not been supported in considering giving the baby up. She doesn't know what her options are, right? Like, maybe there are some supports that would make her choose to continue parenting that she doesn't know about, or maybe there are some other models of adoption, fostering, that she's not aware of right now. So really, what are those options? Giving it to her in a really safe and non-judgmental space. Obviously, individual therapy is a really good place to dive deeper into her own trauma history and how that's impacting her decision or desire to parent. I mean, it's pretty clear that her own adoption history and trauma plays a big role in all of this. It's really sort of a thread that's tied through this whole case. And then I think bottom line with really any parents that I'm seeing for therapy, we want to normalize and affirm. Normalize and affirm is, 90% of the work, I think, with perinatal mood and anxiety disorders, because parenting is hard, right? And I think starting from a place of, this isn't a personal failing, like this isn't because you can't do it, it's because it's hard and because you've had these other experiences, and then going from there is a really key place to start therapy from. And then, yeah, continuing to help mom address these social services, right? Like, if you need to make money to decrease the stress on your family, to feel like you can parent better, you need someone to watch your baby while you go to work. Well, how can we figure out affordable childcare so you can make that decision for yourself? So yeah, those are some of the considerations from a parental standpoint that we're considering.
Thank you. And I think in terms of the infant mental health, really what we're looking at here is pulling out and attending to all of the targets that I had previously mentioned related to ABC. So showing mom all of the moments that she is providing nurturance and following the lead, and really probably for this mom illustrating the long-term impact, whether or not she decides that she wants to continue to parent this child. That in the moments while she's still deciding about that, she can have such a lasting impact for baby, through learning all of these different pieces, and then also reflecting on these voices from the past that might be impacting her ability to really navigate and make a choice that's going to be best ultimately for her and baby, no matter what that is. And so really using the ABC targets to attend to that. And then the supplemental supports, that they may include a circle of security parenting group if she decides to continue to parent this child. So that's also an option, as well as a pregnancy and postpartum support group, and then community support services, as mentioned, as also mentioned in some of the supports that they might be targeting.
So awesome to dive deep and into one particular case to see how all of these things come to play. So we'll be keeping this mother and baby in our thoughts that everything works out as it should. So we're going to take a 30,000 foot level now, look at some policy. Except I'm having trouble affording it. Austin, can you go to the next slide?
All right. You should have control now.
Awesome. Thank you so much. Okay, so at the policy level, as I said, Maternal Mental Health Leadership Alliance is really focused on national policy around maternal mental health. And we have some great federal policy updates. Several years ago, legislation was passed, I think in 2016, to provide grants to states to create programs to address maternal mental health. We have been advocating hard to increase the funding. We've gotten enough funding to double the program, but we're advocating so that every state will have access to these grants. We are also advocating and are successfully implementing some funding to establish a 24/7 dedicated maternal mental health hotline, so that in the middle of the night when moms are up feeding their baby for what seems like the 13th time, they can text or call and get some support right away. There's legislation to create a national task force. There's been a couple of pilot projects focusing specifically on military members. We know that military moms, whether they're active duty or dependents, are at increased risk for maternal mental health issues for a whole variety of reasons. They're away from their home, their family of origin. They move a lot. They're stressed because their partner may be deployed. They're in harm's way, all kinds of things. Congress has introduced a whole series of bills grouped under the Black Maternal Mental Health Momnibus that really focuses on Black women and women from other racial and ethnic minority groups who experience these issues at much higher rates than white women, and also have much harder time accessing care. And we've seen some grants coming out from the National Institute of Mental Health to study some prevention programs. So this is awesome. We're really seeing some change at the federal level to start addressing these issues. And of course, then there's all kinds of things like extending Medicaid and for pregnancy-related care, and paid parent leave and affordable childcare, and all lots of big picture stuff. But these are the ones focused specifically on maternal mental health. And I know at the local level, there's also an important bill that's underway.
Yeah, so a bill that was proposed by Councilmember Henderson and some other folks on the Committee on Health. It's the Maternal Health Resources and Access Act, and it proposed a pilot program to use Medicaid funds to reimburse for doula services in the DMV, and also looking at a feasibility study to see if a birthing center east of the river would be something that could happen, yeah, for the district. And there's a million reasons why those are both just incredibly important and supportive to maternal and infant health and mental health. But it's just really exciting to see that those things are being explored, and that that DC is willing to really put some money behind what we know are some of the most early and successful interventions in supporting positive health and mental health outcomes for our new families.
That's awesome. That's
Mhm.
awesome.
Yeah.
So we also know that we want to leave you with some resources for professionals primarily. So a whole bunch of maternal mental health resources, starting with Postpartum Support International, postpartum.net. It's an international organization, but it has volunteers in every single state and including DC. And these are moms like myself who experience postpartum depression or anxiety and want to give back. Postpartum Support Virginia is the chapter in Virginia. Both of these organizations offer warm lines where moms or family members can call and leave a message and somebody will call back. They have online support groups, as I mentioned, local coordinators, and directory of mental health providers who specialize in treating these issues. And the DMV Perinatal Mental Health Resource Guide is another great directory of local mental health providers. We also have some great services for infant mental health. Georgette, you want to touch upon a couple of those?
Absolutely. I think for families, if you're a professional and needs to refer a family to services outside of mental health, also I start with in-home and home visiting services that can be found through the DC government, as well as early intervention through Strong Start if you have any concerns about baby's development. And then there are tons of psychoeducational resources. I only listed a few. There are certainly in abundance. The Parent Support Program through DC, 0 to 3 is a phenomenal hub of resources and support, as well as the Infant Mental Health Guide for parents and healthcare providers provided by a nursing entity that is worthwhile and very easy to access.
Awesome. And we'll make all of these slides available for anybody who might be interested. So just real quick to wrap up, Austin and Georgette, what is one thing that you wish pregnant people, Austin for you, pregnant people and new parents understood about their mental health during the perinatal period? And Georgette, then what's one thing you wish that parents knew about their infant's mental health? So Austin, why don't you go first?
I think that the most important message to send folks is that you don't have to feel this way. I think there are a number of reasons why this happens, but unfortunately, the message is sort of sent that, new parenthood is so hard, because it is, right? But that it sort of normalizes these experiences of depression, anxiety, other disorders that are not normal and are, treatable, preventable. But folks just sort of assume that, like, this is how it is, especially if you're a new parent, like, this is it, like, this is what it's like to be a new parent. And so I think, like, it's not your fault, and it doesn't have to be this way. There are ways for you to get help and to feel better, is sort of the one message that I would send to all my new parents.
Awesome, thanks.
Mhm.
And how about Georgette? What do you want new parents to know about their baby?
I think just to distill it down in a very simple way, infants have mental health. That just because they can't talk and because they're brand new to the world doesn't mean they can't experience distress that can form very quickly into anxiety and depressive features. And it's extraordinarily important to attend to it, because it's not going to look the same way it does with a verbal person, whether it's a child, adolescent, young adult, or an adult. And so it's really important to understand that babies have feelings too, and it really does impact their development and their growth.
Yeah. Thank you for that really, really important piece of information. There's so much going on in the DC community around maternal child health. The Clark Family Foundation, which is a local foundation, the Clark Construction Organization, decided a couple of years ago to really invest millions of dollars, tens of millions of dollars in the DC maternal child health world, with a specific impact on mental health. And we're seeing this at Children's National Hospital, along with the whole MedStar health system. And so over the course of the next 3 to 5 years, there's going to be some significant changes in really lifting up new moms and babies in the DC area. So that's very, very exciting. I don't know of any other organization, any other locality that has such vast resources coming behind it to address these issues. So both of you are super lucky. You're going to be seeing some of the benefits of this great investment by the Clark Family Foundation. Okay, and just to wrap, there's our contact information. All of us are happy to talk with you about any questions you might have. We love our work. We love talking with other people about it. And there's a couple of big things coming up that Austin just wanted to share with you.
Yeah, so as I very briefly mentioned earlier in the presentation, our maternal mental health program at Mary Center has two events, ways of engaging with the community that we would so love to see you at and share in with you. One is our monthly perinatal mental health echo meetings, which again is an all teach, all learn model for really coming together and sharing all of the beautiful knowledge and expertise that so many folks have on perinatal mental health in our community. And so it's usually the last Friday of every month. We have our scheduled for September, and you can email me to get more information on that and to be added to our listserv to get reminders about our meetings. So we'd love to see you. And we're also gearing up for our third perinatal mental health symposium. We have a really incredible lineup of speakers that we are finalizing, and our theme this year is finding hope in trauma and trauma treatment. So we would love to see you there. Again, you can email me for more information on that. And I think that's all I
Awesome.
have for you.
Yeah, Austin and Georgette, thanks so much for spending some time talking with me this afternoon. And we hope that you enjoy the Mayor's Summit. Remember, that is September 15th and 16th. And as a reminder, the website is dcmaternalhealth.com. Thanks so much and have a great rest of the day.
Thanks, Adrienne.
Thanks.
Whew.